Pneumococcus, also known as Streptococcus pneumoniae, was first discovered by Louis Pasteur in 1881. He identified it as the causative agent of pneumonia. Pneumococcal infection, caused by the bacterium Streptococcus pneumoniae, can lead to a variety of illnesses. The route of infection and its progression are as follows. The bacterium often colonizes the nasopharynx, which is the area at the back of the nose and throat. Many people, especially children, can be asymptomatic carriers, meaning they have the bacteria in their nasopharynx but do not show any symptoms. The bacteria are spread from person to person through respiratory droplets. This can occur when an infected person coughs or sneezes, releasing the droplets into the air, which are then inhaled by another person. Once in the nasopharynx, the bacteria can invade other parts of the body. If they move to the lungs, they can cause pneumonia. If they enter the bloodstream, they can cause bacteremia, a bloodstream infection, or sepsis. If they travel to the covering of the brain and spinal cord, they can cause meningitis. The bacteria can breach physical barriers like the mucosal layer of the respiratory tract, especially when the body's defenses are compromised, either due to other infections, immunosuppression, or other factors. Once the bacteria invade tissues or the bloodstream, the body's immune system responds. White blood cells attempt to combat the infection, and inflammation occurs at the site of infection. Depending on where the bacteria spread and the individual's health, various diseases can manifest. These can range from milder illnesses like sinusitis and otitis media, ear infection, to more severe diseases like pneumonia, bacteremia, sepsis, and meningitis. With appropriate antibiotic treatment and supportive care, many people recover from pneumococcal infections. However, in some cases, especially in the elderly, young children, or immunocompromised individuals, complications can arise, and the infection can be fatal. Vaccination against Streptococcus pneumoniae can prevent many of these infections, and it's recommended for certain age groups and individuals with specific health conditions. Pneumococcal infections, caused by the bacterium Streptococcus pneumoniae, can lead to various illnesses, each with its own set of symptoms. Here are the symptoms associated with some of the common pneumococcal diseases. Pneumonia, high fever and chills, cough often with rust-colored or green mucus, shortness of breath or rapid breathing, chest pain that worsens with deep breathing or coughing, fatigue and weakness, sweating and clammy skin, confusion, especially in older adults. Bacteremia, high fever, chills, low alertness or confusion, rapid heart rate, low blood pressure. Meningitis, high fever and chills, stiff neck, severe headache, sensitivity to light, photophobia, confusion, nausea and vomiting, sleepiness or difficulty waking up. In babies, symptoms may also include irritability, poor feeding, and a bulging fontanelle. Otitis media, ear pain or earache, pulling at the ear, especially in children, difficulty hearing, drainage from the ear, fever, irritability, sleeplessness. Sinusitis, nasal congestion and discharge, pain or pressure in the face, headache, fever, fatigue, bad breath, cough, dental pain. Bronchitis, persistent cough, which may produce mucus, wheezing, shortness of breath, fatigue, mild fever and chills, chest discomfort. Pneumococcal infections are caused by the bacterium Streptococcus pneumoniae. The treatment for these infections primarily involves antibiotics, but the specific approach can vary based on the type and severity of the infection. Here's an overview of the treatment for pneumococcal infections. Pneumococcal infections are typically treated with antibiotics. The choice of antibiotic depends on the specific type of infection, the patient's age, health condition, and whether the strain of bacteria is resistant to certain drugs. Common antibiotics used include penicillin or amoxicillin, ceftriaxone or cefotaxime, levofloxacin, moxifloxacin, or gadafloxacin. Macrolides like azithromycin or clarithromycin, though resistance to these is increasing. In severe cases, especially for conditions like pneumonia, bacteremia, or meningitis, hospitalization may be required. This allows for closer monitoring and administration of intravenous, IV, antibiotics, oxygen therapy, or other supportive treatments. Pain and fever relief. Over-the-counter pain relievers and fever reducers, such as acetaminophen or ibuprofen, can help alleviate symptoms. Hydration. Drinking plenty of fluids helps prevent dehydration, especially if the infection is accompanied by fever. Oxygen therapy. Patients with pneumonia might require supplemental oxygen if they are having difficulty breathing. Vaccination. While not a treatment, vaccination is a crucial preventive measure. There are vaccines available that protect against many strains of Streptococcus pneumoniae. These vaccines are recommended for certain age groups and people with specific health conditions to reduce the risk of severe pneumococcal disease. Follow-up. After the initial treatment, a follow-up with a healthcare provider is essential to ensure the infection has fully resolved, especially if symptoms persist or worsen. Resistant strains. Resistance to certain antibiotics is a growing concern with Streptococcus pneumoniae. If a patient doesn't respond to the initial treatment, the bacteria might be resistant to the prescribed antibiotic, and a different medication may be needed. It's essential to complete the full course of antibiotics, even if symptoms improve before the medication is finished. Stopping antibiotics early can lead to the bacteria becoming resistant and can cause the infection to return.